This is the last little mini lecture in the intracranial regulation concept that covers the exemplar of headaches. This is going to be a short little presentation, but the learning outcome that we want to make sure that we accomplish is to identify the causes, the clinical manifestations, and medical nursing managements of clients experiencing headaches. Cephalgia is the formal term for headaches. It's one of the most common physical complaints. Headaches can be either acute or chronic. They can be temporary or life-threatening. Headaches are a common occurrence and affect individuals of all ages. They are associated with other conditions such as colds, allergies, stress, or muscle tension. And they're classified as primary headaches that have no identifiable organic cause. That primary headaches includes migraines, tension headache, and cluster headaches. And the other category is secondary headaches, and those are associated with an organic cause, such as a brain tumor, aneurysm. They warrant further investigation and medical management. So we're going to talk about all of these in the next couple slides. Headaches may cause a significant discomfort for people and can interfere with activities of daily life and lifestyles. I have a very good friend who has migraines, and when she has a migraine coming on, it completely shuts her down, and she has to get out of all of sensory stimulating things and go in a dark room, but we'll talk about that more in a minute. This is from your Hinkle textbook. I think it's just a good visual to show you where the individual is complaining of the pain on their head, what type of primary headache this is, and where that pain is located. Sinus headaches are pain over the sinuses. They're typically deep, constant throbbing pain, like a type of pressure, and occur after an upper respiratory illness. A cluster headache is localized to the eye or the temporal region, and it's characterized as more of a sudden stabbing pain. It's more common in young men, can occur at night or late evening, and is associated with alcohol use and is a vascular disturbance. So it's where the vessels dilate in the head and cause the pain in the head. Tension headache is usually in the front. It's in the frontal, temporal, or occipital areas. It's dull, tight, and a diffuse aching. It is associated with stress and anxiety or depression. The tension headache is the most common type. And then the migraine. The migraine is, you can have a migraine with aura and you can have a migraine without aura, but it's a complex headache that has a lot of different symptoms depending on the individual. It usually affects one side of the face, and the client can experience vertigo, which is dizziness, or tinnitus, which is ringing in the ears. There can be numbness or tingling in the fingers or toes. It can be triggered by emotions, by different foods or odors. It's a throbbing pain that usually has nausea and vomiting, and photophobia and phonophobia, which is sensitivity to light and sound, can last up to days, and often can have an impact in the activity of daily living up to from 4 to 72 hours. It also is a vascular disturbance, so it is the vessels in the head are dilating and causes the pain in the head, and the migraines are more common in women. Migraines with aura are divided into 4 phases: the premonitory phase or the premonition phase, the aura phase, the headache phase, and the postdrome phase. So in that first phase, the premonitory phase, symptoms can occur hours to days before a migraine headache. The symptoms can include depression, irritability, feeling cold, having food cravings or anorexia where you're not eating, change in activity level, increased urination, diarrhea, or constipation. When the client gets into that aura phase, it can be pretty variable based on the person that's experiencing it, but they usually have visual disturbances, so they can have light flashes and bright spots. It usually affects a half of the visual field, so that's term is hemiopic. The headache phase is usually very incapacitating and extremely severe. When individuals are in this phase, they literally have to go into a dark, silent room to get through this headache phase. They can have abnormal perception of smell, sound, and light insensitivity. When they get to that last phase, the post-ROM phase, the pain is actually subsiding, but it's a very gradual subsiding, and they are very tired, weak. They can have cognitive difficulties and mood changes for hours to days. People are just completely wiped out by these migraines. So secondary headaches, again, are associated with some type of cause, whether that's a brain tumor, an infection, an aneurysm. The clients do not have any prodromal stage, and it is usually, the headache varies depending on where that cause is. So the location of the tumor, the location of the infection. It's more common in the morning, and it will vary in intensity. So in assessment of a headache, you're going to want to make sure that you get a detailed description of the headache, which includes the medication that they have taken, other interventions they have done to try to help the headache. The type of headache can manifest differently from person to person, and it can change over time. So making sure that you assess how it is impacting that individual. Most headaches don't have a serious disease process involved with it, but someone that has persistent headache and is impacting their activity of daily living requires investigation and a good neurological exam. Diagnostic testing may be used to rule out any other type of cause that, especially if there's any type of neurologic abnormalities when you assess them. So nursing management of headaches include providing individualized care and treatment. Prophylactic medication can be used for recurrent migraines. This includes migraines and cluster headaches can require abortive therapy, which is used to alleviate the pain during that aura or soon after the headache starts. So for mild migraines, you're looking at NSAIDs, maybe acetaminophen or over-the-counter anti-inflammatories. Sometimes the medications such as antiemetics to relieve the nausea and vomiting might be needed. For severe migraines, we might be looking at triptan, medications that produce a vasoconstrictive effect. So if the headaches are being caused by vasodilation or a lot of blood being rushed to the brain, we will use some medications that constrict that blood flow. So vasoconstrictive flow. Sometimes caffeine can help as well. Other things that we can do to help clients with migraines would be to provide comfort measures such as a quiet, dark room, have them remain in a cool, dark, quiet environment, possibly a massage or local heat for the tension. It's very important to also have the clients record a headache pattern, like keep a diary on their headaches and what triggers their headache, report changes in headache intensity, any type of change in visual or neurologic disturbances, so that we can keep a good record of what that headache does to them and how it impacts them. I talked on the last slide about educating the clients to keep a diary to record their headache patterns and their triggers. That's the first bullet point here. Another piece of client education would be for those individuals to avoid those triggers. So avoid foods. A lot of times, tyramine, nitrates, things like that, MSG, preservatives, they can cause migraines. So having them stay away from processed meats such as salami, hot dogs, sometimes pickles, caffeine, different cheeses, artificial sweetener, things that have MSG. Alcohol can cause it. Making sure they identify what's triggering it and then avoid it, right? Stress reduction techniques are also very appropriate for education, modifying their lifestyle to make it healthy, promoting healthy activities, getting adequate sleep and rest, avoiding that flickering lights, avoiding glare. A lot of times, individuals that have their menses, that they have a time where they have hormonal fluctuations during their menstruation, and that can cause their headaches. So making sure that they're aware of that, making sure they try to avoid intense environmental odors or perfumes or tobacco smoke. Those are all areas of nursing management to educate our clients to hopefully help them prevent or manage their headaches so that they can have a good quality of life. And that concludes the mini lectures that are in the intracranial regulation concept. So you have reviewed the intracranial regulation concept, stroke, seizures, and headache. Please let me know if you have any questions.